So cataract surgery, I would say, is the most common surgery in the world. Everyone will need cataract surgery eventually. It's performed usually with a local anaesthetic. You can instead have a general anaesthetic and rather go to sleep as long as you're fit and well. Usually we use the high-powered microscope and microsurgical techniques. It takes around 20 to 30 minutes to do, and it's performed using an ultrasound to dissolve the lens of the eye, which has the cataract, and place an artificial lens inside the eye. Fortunately, cataract surgery is perhaps one of the safest surgeries in the world. I would usually quote around a rate of around 95% chance of making things better and improving the vision. For some patients with other comorbidities, particularly previous eye history, then these rates can be slightly lower. I think that most patients would expect the vision to be blurry in that immediate post-operative period and pick up in the first few weeks. I'm often asked, when is the right time to operate on a cataract, and the opinion of when cataracts are right. I think it really much depends on the visual acuity of the patient, how much symptoms they're experiencing. In terms of the surgery itself, I'd say that very early cataracts may be slightly more difficult to do. As very advanced, very dense cataracts, the surgery may take longer to do and indeed longer to settle down with an increased risk. Cataract surgery and the local anaesthetic usually takes between 20 and 30 minutes, lying flat on the table and looking at the microscope whilst you hear the sounds of the machinery and the ultrasound operating. After cataract surgery, many patients remember this as being an instant improvement of vision, but for most, this takes a few days, if not a couple of weeks, to get the maximum out of the vision. Usually the eye can be a little bit red or a little bit gritty or watery afterwards, and that usually settles down. You usually have a prescription of steroid and antibiotic eye drops to use for those 4 weeks following the surgery also.